Hello and welcome to the Comprehensive Mental Health course for midwives. This is the overview of the course. We will be going over what each section will include. Welcome! Emotional and mental health are so important for both you and your patients. Being healthy emotionally can promote productivity and effectiveness in activities like work, school, or caregiving, as well as reduce the risk of mental health disorders. In this course, we will address the psychological, cognitive, and emotional aspects of mental health and illness in both the childbearing and general populations. We'll learn about the epidemiological risk and protective factors that have a profound effect on the incidence and prevalence of maternal mental health disorders. We'll cover perinatal mood and anxiety disorders, including diagnosis and treatment, and the business side of maternal mental health for your practice. The outline for this course is 1, the introduction, 2, risk and protective factors for mental health issues, 3, common mental health disorders. This is in the general population. 4, perinatal mood and anxiety disorders. This is in the maternal population. And finally, the business side of maternal mental health. So, with one introduction, this is broken down into 5 sections. The first one is, why is mental health important? The second is some unique challenges that midwives run into regarding mental health. The third one is the midwifery scope of practice. Fourth is functional medicine for mental health. And finally, building your network. Now we address the risk and protective factors. The factors that we will be looking at are culture, both the positive and negative aspects, stress and coping, a support network, nutrition, eating right and eating healthy, exercise, mindset, and finally, genetics and environment. We will look at both the risk and the protective factors that these events have. Section 3 is common mental health disorders in the general population. Now, this is not specific to maternal health, but somebody who has these disorders before or after pregnancy can have an additional risk factor when they are pregnant, either the first time or if it's something that occurred after pregnancy in a subsequent pregnancy. So anxiety and panic is the first one that we're going to discuss. Then depression. Next, we'll talk about suicidal ideations, which is not a disorder in itself, but it is definitely worth a focus area on this presentation, and it could lead to or be a symptom of many of the common mental health disorders we're discussing. D is dissociative disorders. E, we'll talk about bipolar and borderline personality disorder. F, we will talk about schizophrenia and some other psychotic disorders. G is obsessive compulsive disorder. And finally, substance use disorder. Section 4, this is specific to our mothers. Perinatal mood and anxiety disorders, focusing on mental health in pregnancy, and then childbirth-related mental health, and then finally, postpartum mental health. The last section is the business side of maternal mental health. So we'll talk about charting, legal defense, billing for mental health services, adding ancillary services into your practice, some assessment tools and templates, the certifications that are available, and finally, resources. And just to share a legal disclaimer, just so you know that all information here is for general and informational purposes only. The content here is not or intended to be a substitute for professional, legal, or clinical advice. And while we strive to make the information as timely and accurate as possible, We make no claims, promises, or guarantees about the accuracy, the completeness, the adequacy of the information contained, and expressly disclaim liability for errors and omissions. So after all that, if you have any questions at the end of the course or even halfway through the course, even at the beginning of the course, feel free to contact us. You have the email and the contact information on the Teachable platform, so please reach out at any time. We look forward to seeing you in our other offerings.